My name is Thomas Laqueur. I'm an Emeritus Professor of History at Berkeley. And I want to welcome you to the first of two lectures on the issues of guns and gun violence in America. We're doing these in reverse chronological order. That is to say, we're going to talk about the present this time, and we're going to talk about the past with Brian DeLay in a couple of weeks. So we're honored and pleased to have today Garen Wintemute, who is the Susan P. Baker Stephen P. Terrett Chair in Violence Prevention at UC Davis, which means really he's director. He has two hats, really. He's director of the Violence Prevention Research Program at Davis, which is a multidisciplinary program that looks at the causes and consequences and one hopes ways to prevent violence. The center is actually the first state-funded center for violence research. It was founded in 2017 in a way because the CDC wasn't giving out data on violence in America, and California, having a huge population and lots of data, decided to sort of combat that or meet that by setting up this center. So on the one hand, Garen is a injury epidemiologist and a public policy person with respect to gun violence, but on the other hand, or the other hat, he's also an attending physician in the emergency department at Davis, which is to say that he has firsthand knowledge of some of the 30,000 deaths and 75,000 non-fatal injuries caused by guns. He's testified before Congress and in the Bureau of Alcohol and Tobacco, Firearms, and the National Institute of Justice. He is one of America's leading experts on the question of gun violence. And so we really are awfully happy to have him. Garen.
Thank you, Tom. And hello, everybody. It's a pleasure to be here. What I would like to do is move through some data, sort of look into the abyss about the situation with regard to firearm violence, spend a moment looking at some new research on political violence, which may be the next large-scale incarnation of firearm violence in the United States, and then swing to the hopeful side of the talk, and we'll talk about things that people can do. There will be plenty of time for open discussion. I'm going to move very quickly, but the talk is recorded in case I hop, skip, and jump a little bit too quickly for folks. Please post questions and comments in the chat as we go. Tom will queue them up at the end, and we'll also have some open mic time. But let's get right to it. I'm going to share my screen. And Tom, give me a thumbs up if you see full screen slides now. Is that correct? Good, thank you, got it. So we're off to the races. Start with a couple images. I get asked sometimes what got me into this. I was a clinician first, a researcher second, see research as a way of helping to deal with a problem that I first encountered clinically. And if you want the clinical side as a straight shot, Google the title of that New York Times op-ed on the left, How to Tell a Mother Her Child is Dead. It's the best single summary of the clinical experience of dealing with violence that I've ever seen. It is a New York Times op-ed. It's also what we call a procedure protocol. And the title of the article is the name of the procedure. I will leave it at that. Don't read it shortly before going to bed. The other image is of Dr. David Satcher, who shortly after he became head of CDC 30 years ago, when rates of violence were higher than they had ever been, at a peak that we have achieved again, and I'll show you that on the next slide, was asked, because at the time it was a hard sell, so why are you all talking about violence as a health problem? He said, look, to the New York Times, he said, look, if violence isn't a public health problem, then why are all these people dying from it? It's just really that simple. So let's spend a little bit of time first looking at all the people dying from it side of the issue. The pandemic has upset many apple carts, and this is one of them. We experienced our largest ever increase in homicide, both in absolute and relative terms, on an annual basis as we moved from 2019 to 2020. We did that for suicide in 2020 to 2021. We're closing in on 50,000 deaths from firearm violence a year, about the number of people who die each year from breast cancer. It's also the case that firearm purchasing skyrocketed. I'm going to show you that in just a second. And finally, I'm going to mention that third bullet, partly to qualify it. My guess is that you've already heard or read that firearm violence has become the leading cause of death for children in the United States. That statement is technically correct, but as we'll see in a moment, it does not mean that there's a sudden surge in firearm violence mortality among young children. But let me show you purchasing. This is something that we track very closely. We're gun people here. And the graph is showing you NICS checks. NICS is National Instant Criminal Background Check System. The background checks that are performed incident to firearm purchases around the country. The red line shows you what happened, and I'll come back to the blue line in a second. So first notice over on the left that there's a regular irregularity to this curve. Purchases peak towards the end of the year because people are buying guns for gifts, and they peak in the springtime to early summer because they're buying guns to go hunting. Notice 2016 over there on the left. There's an extra peak in presidential election years. People buy guns more out of fear than for any other reason. And in federal election years, there's the superimposed fear that, gee, maybe the gun control guy will win. And so I better buy the guns now that I won't be able to buy if those people take over the White House. So there was a peak in 2016, as there is every 4 years. But then come to 2020, and I'm an ER doc. I was reading about COVID before it got here. We were tooled up and ready to go and had the first community transmitted case at our hospital, in the country, at our hospital. But we expected gun purchasing to go up. So we started following it on a monthly basis. And so what you see on the right is this. The red curve continues to report to you on a monthly basis through last month what actually happened with regard to background checks. The blue line now shows you what was predicted to happen if the curve of the prior years had continued forward without interruption. So yes, people saw a pandemic coming, they got scared, they started buying guns in record numbers. But it didn't end then. The pandemic arrived and social instability did come. We all locked down. And then we unlocked in the summer of 2020. And there was George Floyd's murder and other instances of police violence and reactions to it. And firearm purchasing stayed up. It didn't go down as it usually does in the summertime. But 2020 was also an election year. So yes, firearm purchasing rose at the beginning, at the end of 2020. But as we all recall, because we all lived through it, it wasn't an election unlike any other. It was a contested election, contestation ending, or so we thought at the time, in an armed assault at the Capitol, on the Capitol, incited by the then sitting president. Okay, but we're done with that, right? Joe Biden gets inaugurated and we're moving on. But no, first off, this time the gun control guy does win. And second, as terrorism experts pointed out by mid of 2021, everybody wants to see January 6th as the end of something. We, they said in mid 2021, see it as the beginning of something. And so it has proven to be, and we'll look at that again in a minute. But what you see is that with a decreasing margin of difference, we have lived through a period which only just last month appears to have probably temporarily come to an end, a period of time during which firearm purchasing, as approximated by background checks, was on average over the period of time I'm talking about here, 37% above normal. Almost 20 million excess firearms, not 20 million firearms, excess firearms, again, as approximated by background checks. So the upshot of this is this. We're living through a gigantic national experiment. We have no choice at this point. We're living through the period of time that is going to answer this question. What happens when you take a society that is increasingly fearful, increasingly mistrustful of its social and governmental institutions, a population that is increasingly mistrustful of itself, increasingly angry, increasingly polarized, and you throw a bunch of guns into the mix? There's actually a literature showing that an increase in availability of firearms is typically followed by an increase in violence, and we're going to see what happens. Some argue that we already are seeing in the trends I mentioned earlier. Well, let me step away from that, and let's look just at the near present. The 2021 data just came out. I apologize, I haven't updated the slides. We're going to look at death rates from firearm violence for men. Rates for women are about 10% of those for men, and for sake of time, I'm just going to show the group at higher risk. This first slide for homicide tells a story that you're familiar with, even if you've never seen the image. This is the graphic depiction of the truly remarkable and terrible concentration in risk for firearm homicide among young Black men in particular. Risk skyrockets in adolescence and young adulthood, declines thereafter. There are similar trends within themselves for Hispanic men and white non-Hispanic men, but the absolute magnitude is obviously completely different. This is the story that you know. But look at suicide. It's quite different. If I can switch hats to stick with Tom's metaphor, I am a practicing ER doc, and I've learned that a bullet really doesn't care whose finger's on the trigger. Deaths from firearm violence are violent events. Here's how violent they are. Let me put it this way. Here's how virulent they are. Most people, it was 2/3, now it's about 60%. Most people who die from gunshot wounds die where they're shot. Death is instantaneous or within an hour. It does not matter how quickly the ambulance gets to them, how quickly that ambulance gets to us, how good we are at the ED, how good the trauma surgeons are. Those people are just dead. When I give this talk to a clinical audience, I remind them, for you to be maximally effective in preventing violent death from firearm violence, you need to prevent people from getting shot in the first place, which is my career in a nutshell. But back to firearm suicide. What we see here is rates go up early, but the pattern is different. First off, they go down, but only slightly for two of the groups on this slide. But for the group at highest risk, white non-Hispanic men, they go up slowly, and then they go up much more rapidly as we near the end of the life course. Note also the y-axis here, the vertical axis, tops out at 60, not at 140, the way it did on the prior slide. So what I'm going to do now is combine homicide and suicide to make a point. So this is homicide and suicide, all of it violence, some similarities and some differences. About 90% of deaths from firearm violence among Black men are homicide. So this is that homicide curve from 2 slides back, plus 10%. It looks essentially the same. The y-axis is now at 160. About 90% of firearm deaths among white non-Hispanic men are suicide. So the green line is the green line you saw on just the last slide, plus 10%. But the rate is so much lower that that line has been, if you will, squished flat to make room on the slide for the much increased risk among young Black men. What I've done so far is take a traditional public health approach to this problem by focusing on risk. Deaths per 100,000 persons, 100,000 men in this case. No criticism here. That's an entirely valid approach. We all use it all the time. But there's a complementary approach called the population health approach, which notes that it's also of interest to know for the population as a whole, where does the burden fall? Where are most of the cases in the population? For any health event, most of the cases can occur in a low-risk population if that low-risk population is big enough, right? Simple, that's simple logic. The implication of it is if we just focus on the people at highest risk, we may not affect the population level burden all that much. So the way to go from risk to burden is to go from rates to deaths. The way to do that with the data you see on this slide is to take the denominator away. So I'm simply going to use the same deaths that are represented on this slide and take out the per 100,000. And here's what happens when you go from risk to burden. This is risk. This is burden. This is deaths from firearm violence. Let me go back. Risk, burden. The obvious change is in what happens with the green line. It's simply the case that on a population basis, first a plurality, and then as age advances, a majority, a very large majority of the men who die from firearm violence are white non-Hispanic men. A point I make for these reasons. First, I don't make it for this reason to in any way undercut the tragedy that is occurring among Black men, and in particular among young Black men. I do it for these reasons. Generically, to remind us that we all have skin in this game. More specifically, as someone who's been doing advocacy for as long as he's been doing research, I know firsthand that it has been a key element in our lack of progress on firearm violence, that we frame it as crime. We think about interpersonal violence, and policymakers who tend to be older, white, non-Hispanic, and male look at the group at highest risk and perhaps subconsciously, perhaps not, go, not my people, not my problem, and we don't make progress. Who knew that firearm violence was really so much an old white guy problem? And finally, in this series, let me show you kids. This is that asterisk that I mentioned earlier. Here we are looking just at age. We're not looking at boys and young men, and we're not looking at race and ethnicity. We're looking at intent. My point here is that even at the time when when firearm violence was evolving into the leading cause of death from ages 0 to 19, the action was all at ages 13 and up. And in fact, even in 2020, with the start of the pandemic, there remains this 10 to 12 year period during which, epidemiologically speaking, almost nothing is happening. But it's during those years that life courses take the trajectory that either does or does not put young people at risk of becoming part of that increase that we see in later years. We spend far too little time working on primary prevention in children. Okay, I'm going to change topics slightly, but we're still dealing with the current situation. Efforts to the contrary, we have made the absence of progress. We've gone in the wrong direction on ownership and storage. In 2015, a third of households had firearms, and 1 in 5 of those kept at least one gun loaded and not locked up. If you have a gun for protection, which is why most people buy guns, you want it right now when it's 3 in the morning and footsteps in the hallway. And too many people think that that means storing the gun loaded and not locked up, where they can find it easily, but so can their child. So can they when they're in a moment of despondency, perhaps fueled by alcohol. And we've gone in the wrong direction. The prevalence of ownership has gone up, and the prevalence of unsafe storage has gone up. In fact, this has happened. When I started this work 40 years ago, most people believed, more than 60% of people believed, that bringing a gun into your home makes the home a riskier place. Now, in 2021, 22, 60% of people believe that putting a gun in your home makes the home a safer place. They've gone in the wrong direction, despite the fact that the evidence on risk associated with firearms in the home has gotten very much stronger since the early 80s. The best evidence actually comes from here in California, comes from a group headed by a friend of mine at Stanford, David Studdard. I'm a team member on this work. But it makes, Tom mentioned the unique data that California has. These studies make use of it. And looking at huge cohorts of gun owners compared to non-gun owners, knowing exactly when a person who was not a gun owner became a gun owner for the first time, because we can do that in California, what we've learned is that bringing a gun into the home triples the risk of suicide for men, increases it by a factor of 7 for women. The changes are even greater for firearm suicide, as you can see there. So when you see HR 7.8 under firearm suicide, that's hazard ratio. It's a fancy term for relative risk. But think increasing by a factor of 7.8, 780%. And the risk is not limited to the people who own the guns. As you can see, risk goes up, particularly for women and intimate partner homicide. Risk goes up for other occupants of the household. And it's despite such information that public information has swung in such a direction as to facilitate the surge in purchasing that we looked at a moment ago. All right, now I am going to change topics, and it's going to get really scary. You'll remember that surge in purchasing. We started investigating and came to understand that one of the developments of 2020 that has carried forward into 21 and now to the present is an increase in public outbreaks of and support for political violence. So we started some survey research, and I'm going to walk you through just a few of the results. We did a survey in 2022. We've got another round just off. We just got the data a couple of months ago. We haven't even finished taking the lid off the box yet. But a large-scale, nationally representative survey, more than 8,000 people in the main sample, some oversamples of firearm owners and Californians and others for some special studies that we're going to be doing. We had a good completion rate. I'm going to move too quickly to say these numbers. A representative population, and the minor differences were taken care of through statistical procedures. And here's what we found. We asked people, we presented people with a bunch of statements, and we asked them if they disagreed, somewhat agreed, strongly agreed, very strongly agreed. And I'm direct quoting here so that you can see exactly what people were asked. 2/3, and this is in 2022, thought that there was a serious threat to our democracy. 1 in 5, 20%, when given the choice, strongly or very strongly agreed with the statement that having a strong leader for America is more important than having a democracy. About 1 in 6, 1 in 7 agreed with a statement of great replacement thinking, that native-born white people are being replaced by immigrants. About 1 in 11 agreed with the core statement of the QAnon conspiracy, the business about station-worshiping pedophiles running the government. Almost 1 in 5 thought the 2020 election was stolen. About 1 in 6 said that in the next few years there will be civil war in the United States. We asked them if they thought political violence was justified. And let me define some terms. Political violence was physical force serious enough to harm somebody. So not shouting and jumping up and down. And political violence was force or violence, is how we described it, to advance a political objective. And here what you're seeing are the percentages of the population who said it's usually or always justified. So a small minority said it's usually or always justified in general for any purpose whatsoever. 1 in 3 said it was justified to advance at least one of 17 specific objectives that we presented in the questionnaire, and you can see 3 examples here. Typically, this is the range between 2.5% to 5%, so 1 in 40 to 1 in 20, said that violence is usually or always justified. So to return Donald Trump to the presidency in 2022, or at the bottom, to preserve an American way of life based on Western European traditions. And then we asked them, for the people who said that violence was at least sometimes justified to advance a political objective, we asked them some questions that basically asked them to put their money where their mouth was. We said, okay, so in theory, you think it's justified. How willing would you yourself be to commit force or violence? So again, physical harm. And you can see the numbers here. About 8% say they would damage property to advance a political objective that they supported. About 5% said, so 1 in 20 of the people who thought it was theoretically justified said they'd threaten somebody, they'd injure somebody, they'd kill somebody. 1 in 20 of these group who said it was justified said on a survey that they were very or completely willing to kill somebody to advance a political objective. We asked them about willingness to commit violence against people defined by who those people were, target populations, if you will. And I won't read these out loud. We had 9 of them. And about 5% of the time, for these groups and others, people who thought that political violence was theoretically justified were very or completely willing to use violence against people like the people you see described here. And finally, we asked everybody, not just the people who thought violence was justified. We said, in the future, and given all that the future might bring, how likely do you think it is that in a setting where you think political violence is justified, you will do the following? And then we again gave direct quotes. And about 8%, about 1 in 12 said, I'll be armed. About 4%, about 1 in 25 said, I'll carry a gun so people know it. And about 1% said, I'll shoot somebody. These are really small percentages. And as somebody who does and consumes survey research, I'm aware that small percentages don't necessarily mean a lot. And we can talk about the details of that if you'd like. I will say this. For the national population of adults, you do the simple back of the envelope extrapolation math, there are about 2.5 million people in each percentage point increment here. So let me wrap this up and change topics and get optimistic. The good news buried in all those results is that most people rejected political violence completely. Over and over and over again, they said, never justified. 2/3. Remember, only 1/3 said even maybe sort of sometimes justified for 1 of 17. Most people said no, over and over and over again. And again, and you saw this, of those who endorsed political violence, most were not willing to become involved themselves. However, there are some subgroups, and I'm not going to show them for the sake of time, where, I'm sorry, and the subgroups with the strongest support weren't more willing than others. And I'm not going to show you that for interest of time, although we've now found some exceptions to that in some sub-studies. But see the asterisk on good news. It is also the case that declarations of support, even by people who aren't willing to become involved themselves, create a climate of acceptance that might facilitate action by the part of on the part of people who don't have those scruples. And finally, as I've said, a small percentage of a big number is a big number. So let's shift and let's talk about things that we can do. I really enjoy that quote on the left. A more modern version, Mohandas Gandhi has, "Be the change you want to see in the world." I get asked often, a mass shooting will happen or some tragedy. Is this the one that's big enough or awful enough or bloody enough or whatever it might be for Congress to do something, for somebody to do something? And probably 20 years ago, I changed my answer to that question, and I now respond with, that's actually the wrong question. The question that's of interest is this the one that is, whatever the descriptors might be, enough that I will do something, that the questioner will do something, that you who are in the audience will do something? And the image on the right I put up just as a shout out to a couple of friends who, after the Orlando, if I recall correctly, mass shooting, when the NRA said do-gooder doctors should stay in their lane and leave firearm violence to experts like the NRA, my friends helped lead the charge, saying, "Excuse us, this is our lane. See the bloody trauma floor from our shift," et cetera. So medical care has a role to play here. But let's talk about what's been done. This is an image that I've taken with permission from a huge study done by the RAND Corporation. The URL is at the bottom. If you want to dig into a very strict, rigorous evaluation of policy, that's the place to go. It's very, very conservative. I don't mean that in a political sense. I mean it in a methodological sense. What RAND did in order to say, as they do here, that a policy may have had an effect on some outcome measure, policies on the left, outcomes on the right, there had to be 3 studies by different groups using different methods showing an association between the policy and the outcome. And they did that knowing that there has been an organized effort to keep the research from being done. So a critique of the RAND study is they're playing into the hands of the nihilists by setting a bar that's too high. But that critique notwithstanding, look at all the things on the left that they have found meet those strict criteria. Prohibitions based on mental illness, comprehensive background checks, prohibitions for domestic violence, et cetera, have been found to lower the rates of crime or violent crime or suicide involving firearms. Every single item on the left, with the exception of permitting requirements, is already in place in California. And I'll show you the result of that in just a moment. California should be proud of its policy action in this field. Note down at the bottom on the left, there are policies that increase rates of violence. Permissive CCW laws, stand your ground laws, both of those centerpieces of the National Rifle Association's legislative agenda, evidence such as RAND has put forward here notwithstanding, neither of those policies is in effect in California. And just this week, last week, the state legislature sent Governor Newsom SB 2, which is the legislature's effort to keep in place a relatively rigorous CCW policy law, the recent Supreme Court decisions on such laws notwithstanding, and the governor is expected to sign it. So there are things that can be done, and California is doing them. And let me show you what many of us think is a demonstrable result. We're looking here at trends in homicide and suicide for California and the other 49 states put together. Back in the 80s, California's firearm death rates were substantially higher than they were for the other 49 states, tracked them very closely. But beginning in the late 1980s and continuing apace through the 1990s, California enacted a series of pioneering statutes. The individual statutes, many of them had been adopted elsewhere, but the package was new. And the result is that while violence rates in the country as a whole decreased, they plummeted in California, such that by the end of the century, the firearm violence mortality rate in California was lower than it was in the rest of the country, not higher. And the bonus prize has been that until the pandemic really upset all the apple carts, the violence rate in California was trending downward while it was trending upward in the rest of the country, such that in 2020, despite the increase in California that you see, the rate in the other 49 states put together was 60% higher than it was in California. In Texas and Florida, and I'm going to, in the sake of time, I'm going to withdraw that comment. Never mind. We're going to leave Texas and Florida alone. I'm going to move on and kind of wrap this up in the next few slides so we can get to comments and questions. I wanted you to see some things that we do here. We spend a lot of time training clinicians how to prevent firearm violence in their practices. And it's sort of like COVID. We tell people, study up. Very few doctors know enough about guns to feel comfortable talking about it. No doctors knew enough about COVID a few years ago to feel comfortable talking about it. So, doctor, study up. It's what you went to school for. Bring the issue up in your practice when it's appropriate. You got somebody who's suicidal, maybe you should talk about guns. You got somebody who's there for a sprained ankle, maybe not. Be tailored and respectful, just as you are if you're having a conversation about smoking or alcohol or seatbelt use or any other aspect of healthcare maintenance, and have some concrete goals for the conversation, which you can see there. And if anybody's interested, there's a URL at the end of these slides, and you can go in and see a whole website full of this kind of information that is written for clinicians, but is very accessible. It's a good place to go and study up on this problem as a layperson. We also talk to researchers a lot, and there are a lot of researchers or former researchers in the audience, so these are messages for you. We tell people, pick the questions that matter. We do applied work here by and large. Think outside the box, as physicians have been doing on this issue for a long time, expanding the scope of what it means to be a doctor when it comes to firearm violence. Don't be done when the science is. It's not enough to get an article published in a journal. The people who can do something with the results need to know about it so they can do that something that they do, and train the people who will follow. We spend a lot of time here training new people. I am, by a full generation, the oldest person in my program. But here is the stuff that, whether I'm talking to a group of, I'll assume, seniors, because I'm talking to retirees, or I'm talking to students, this list that you see on the left stays the same. I will fess up that the image that goes with it changes to fit maybe the audience. But the first thing is, as individuals, if we suddenly come into that moment where we are the person whose actions may make a difference for thousands, or for a person, or for a group of people, we have to do something. If somebody is in a moment of crisis, if they're threatening to harm themselves, if they're threatening to harm others, we can't be that person who's not willing to take action to forestall a tragedy. We can work to improve firearm policies, but here in California, much of that work has been done. We need to think more broadly about what are sometimes called the social, or I prefer structural, determinants of violence, the things about our society and our culture that make violence seem desirable or inevitable or essential. Hospital-based violence intervention programs work. Take a young person who's in the hospital because they've been shot and do what you can to change the trajectory. Because if they get shot again, they might not be so lucky. Community-level violence prevention programs work. Know where the hot spots are. Put your resources there. Chill them down. Help the people who live there chill them down, even better. It can be done. It is being done. It's being done all over the Bay Area in particular, I should mention. improve access to the basic sorts of things. These are the last two bullets put together, the absence of which for too many people makes violence seem the only way to a solution. Think about it this way. Here's a common denominator. Whether I am a young person of color who knows that I have been deprived of a decent education, a chance at a good job, a chance at good housing, I'm watching my friends die around me. I don't think I have many more years to live because my friends are dying and I'm 18, or I'm an elderly, white, non-Hispanic male veteran, and I'm sick and I can't get access to good health care, and all my friends around me are dying. Both of those men feel like they have no future. They're both wrong. We need to help prove that. We need to create a society that makes them wrong. People who commit violence are people who feel like they don't have an alternative. It's our job to make those alternatives available. I'm going to stop there with this slide. That's how to reach me. That's how to reach us. And that's how to reach bullet points. And you can Google my name on the internet if you don't have time to jot these down.